before we leave. Okay. All right, welcome everybody. I'd like to call the September 18th, 2024 meeting of the Board of Health to order. First item we'd like to do is a roll call.
Mr. Harding.
Here.
Dr. Hayes. Dr. Lindenman.
Here.
Mr. Lynn.
Here.
Ms. Rylander.
Here.
Ms. Van Rainey. Ms. Vincent.
Here.
Thank you. We have a quorum. Next item on the agenda is the adoption of the agenda. So it is recommended, everybody has a draft or recommended agenda. Well, entertain a motion to approve or other discussion.
I move to approve the agenda. I'll second.
We have a motion and a second. Any further discussion on the agenda? Hearing none, all those in favor, please say aye. Opposed, same sign. Motion carries. Next item on the agenda is the approval of the minutes. Item A is the approval of the minutes from the July 17th, 2024 meeting, which we tabled. Item 2 is from the August 21st meeting, which hopefully everybody's had a chance to review. Any discussion, comments, or I'll entertain a motion on either or both.
Oh, the only thing I wanted to say is that, while I didn't see any, I mean, I think they're fine. We probably don't need, if we want it to be shorter than just kind of the transcribed version of what we talked about, that would be fine too, as long as it's just a sentence or two to get the gist. So I don't want to make any more work for everybody than we really need, so. But I will otherwise vote to, I will otherwise move to approve the minutes. Second.
We have a motion and a second. Is that for the minutes from both meetings or just?
For both meetings? Both meetings.
We can approve the first of them.
Okay, you say so.
Nothing.
The first meeting I was not here, didn't have.
Yeah, he wasn't here.
Oh.
Can you still act on the minutes or not?
First meeting, you can't expect.
Okay,
So I will move to approve the minutes of the July meeting. Second.
we have a motion and a second. Any further discussion? Hearing none. How many do we need to pass a motion?
We have a quorum, so you can, unless it's a bylaw change or something like that, you can.
Majority of the people. Okay, great. So all those in favor, please say aye.
Aye.
Opposed, say nay. Abstained? We have one. Motion carries. So the next item is the minutes from the August 21st meeting.
I will move to approve the minutes from the August meeting with, I think I already mentioned this to Michelle, but the one caveat is in public comment, the one woman who commented if we could get rid of the street name of the street that she lives on, which I think I already told you, but I will move with that change to approve the minutes. Second.
All right, we have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, board president announcements. The only announcement I have is to the board members, please speak into your microphone so that what you say can be clearly heard by everybody in the room as well as for the record. Next item on the agenda is the health officer's presentation and report.
Thank you. I want to give you a quick update on the Health First Indiana, which we call HFI adoringly. Right now, we're in the middle of the grant process for next year's funding. We had around 45 applicants, very strong, very competitive applicants this year. We were able to meet with the grants committee to select the finalists for the letters of intent. And we notified the new finalist yesterday that they were selected and would need to now go ahead and submit a request for proposal or an RFP. And today, the people who already had a grant this year that have reapplied for next year, the ones that we are going to consider for the reapplication process were notified. I also just want to give a quick brief overview of the many events that the Department of Health has been hosting and participated, especially in this last month. Environmental Services are hosting their first day-long program this next week, training individuals in lead-based paint management, which is very important. The unit's radon testing program has been going very well. The program has partnered with 6 libraries and a local physician's office in a targeted area of our county looking for elevated radon levels. You'll be hearing more about that later in this presentation as they are the unit spotlight today. The environmental team is keeping our water, soil, and air safe for our community. And our vector program is very busy. Obviously, this is mosquito season still. They are sampling mosquitoes for West Nile's virus and other mosquito-borne illnesses. We are very fortunate to have testing that is done in-house. So we have real-time analysis and reporting of our mosquitoes population in St. Joseph County. You can find that on the St. Joe County Health Department website. Vital Records is in the process of setting up a paperless counter. It will enable our citizens to obtain birth and death certificates in an expedited fashion while saving paper and money. One never realizes the importance of getting a death or birth certificate in a timely fashion, and often with a young baby in tow if you're getting your birth certificate, until you need to apply for insurance, register for Social Security, or complete business and schooling transactions. The Foods and Pool Unit has been extremely busy. In addition to their usual restaurant inspections and pool inspections, they have been very, very busy with community events that require inspections, and that includes Notre Dame home football games. Think about that one. The very large 2-day Fusion Fest that occurred over the weekend, and the September Fest that was held at the 4-H grounds over the weekend. Many of the food vendors that they saw over the weekend were new to the food preparation and selling business and had to be educated about proper procedures and policies. And we truly appreciate the extra time our unit took to provide information and keep the community safe. Our nursing unit has been very busy with back-to-school vaccinations and helping families provide documentation of their children's vaccines. In addition, our nursing department is helping with animal bites. One week recently, we had 7 bat bites reported. Our nurses follow patients being treated for TB, rabies, elevated lead levels, and many, many phone calls that we receive from community members, doctors' offices, and schools who have general health questions and concerns. We have 100 public, private, and parochial schools in St. Joe County. We have a school nurse liaison, and she held a very well-attended conference one evening this week from 4 to 7 after school, and educated county nurses from throughout St. Joe County about resources available to them. We got to hear a wonderful presentation from an Indiana State Department of Health entomologist about school nurses' worst nightmare, lice and bed bugs. Our care team helped to host a big event in North Liberty over the weekend. We partnered with 10 organizations to provide immunizations, first aid kits, radon test kits, and mosquito repellent, as well as checking blood pressures. Our community health workers are our feet on the street to help with insurance navigation, helping those who are either uninsured or underinsured get signed up for health insurance, doing social needs assessments, and helping those who have been displaced because of fire, other emergencies, doing lead testing, and helping some of the most vulnerable in our community get connected to prenatal care and following them for the next 90 to 180 days. We have a new EMBER program. EMBER stands for Empowering Moms and Babies with Education and Resilience. That started last week at the Beacon Resource Center. There is a free series of maternal health classes tailored for every stage of pregnancy. EMBER also offers a bi-weekly peer support group, and they provide a welcoming space to openly discuss life after childbirth. All women of St. Joseph County at all stages of pregnancy are welcome. As you can see, the health department has been working hard for our community. Our team is passionate about their work and they want to continue to serve those in our community so we can all be our healthiest. Thank you.
Very nice. Thank you. Any questions for Dr. Migliori?
I have one. The opportunity to continue with the forum or presentation with the school nurses, is that something planned?
Yes, that we have a dedicated school health school nurse liaison that started in March. And she has been very busy visiting all the schools in St. Joseph County and making them aware of resources that we have, serving as a resource. She's out every day visiting schools, talking to the nurses, finding out what their needs might be, how we can help them meet those needs. And then the first conference that she just held was this week and helping to educate them. So that will be an ongoing, we have a dedicated person doing that.
Long overdue. Thank you.
She's awesome.
I was going to ask about you mentioned she had a training session for county nurses. Is that? from
Everybody in-
schools?
yeah, school-
from
yeah,
the
I'm
private
sorry.
sector?
It's all school nurses in the county were invited.
Gotcha.
And it was very well attended. And it was also a chance for them to get to know each other too, because they're very isolated in the schools where they are too. So it was a networking thing. It was very nice.
Great.
How is the donation program going?
The don-
Um,
It's,
I mean, I know we have the money that we approved and that's going through the process of the rest of the government process, but other donations are being accepted or, yeah. How's that going?
Ashley, do you mind just coming up really quick? It's going great.
Oh, good.
But maybe she
Mhm.
can give you a few of the details.
Hello. So yes, our community partner program is going very well. We've seen a big response from the community. We are receiving items pretty much daily from our wish list, and the schools are requesting those items. We're meeting next week to go over some of that so that we can get those out. So very positive response, lots of questions, and people that maybe didn't know of the needs are now aware of them as well and are excited to come work alongside us.
And are there any specific items that the nurses are most in need of, or that I know we had kind of that general list of kind of different areas, but is there anything really specific that everybody seems to be asking for?
So a lot of menstrual products are being requested and a lot of those are being donated. So that it must be the time of year. But an area that I'm hoping to receive more donations in are the pants. I think because they're expensive, it's going to be a little bit more of a specific effort to have places do donation drives for those instead of maybe just having somebody send something off the wish list.
Okay.
Great. Thank you. Any other questions on?
One thing I was wondering about with the event in North Liberty, is how, did you, measure or kind of figure out even anecdotally where people were coming from? Is it specifically people from North Liberty, or people coming from Walkerton or from South Bend or from Lakeville? How broad?
Alyssa is our assistant unit director of the care unit.
Hi, I worked closely with the community health worker Kayla. It was her wonderful idea to bring all of these community partners together to help support North Liberty and just show this community that we're here for them and everywhere in the county. And then I worked closely with Matt as well, our event coordinator, to help put this program together. And I was there on Saturday, so I'm happy to answer any questions. I believe you asked about sort of the spread about how many people were there, or
Yeah, or even, and maybe you couldn't figure this out, don't know, but just kind of, was it mostly just people in North Liberty or people coming from further away? Do you have a sense at all?
roughly. I will say that we actually just had a debrief about the event today, so
Uh-huh.
Good timing, Matt. I believe that most of them were local residents. We did have some people from a little further away, specifically for our immunization clinic.
Okay.
So there were some families with school-age kids who either missed the cutoff for whatever reason, or
Uh-huh.
they maybe weren't able to get into their provider's office during the work week due to conflicts or whatever, that drove from a little further away to be able to receive the immunizations for their children.
Okay. Do you think you might do more of these events in some of the other small towns in the county? Having seen how it worked here in North Liberty?
This
maybe-
was the first sort of event of its kind that we've done, and I
Uh-huh.
think it's given us some really valuable lessons.
Uh-huh.
People were so appreciative of our presence there. Even people who weren't able to use our services were really glad to see that we were, the health department has a presence in every part of the county.
Yeah.
And so we would definitely be interested, I think, in working with other smaller towns. This one just happened to be our community health worker is stationed there
Mhm.
and lives there and is a local resident, so that was the natural sort of go-to. But if we were to have a rapport with other parts of the county in the same sort of way, I'm confident that we would definitely consider pursuing similar events in the future.
Mhm. No, I think it's great that you're reaching out to some of the smaller towns. And, sometimes, I grew up out in the county, so you're driving everywhere to get to things that you need. So having something close, especially if you do have issues with transportation, is very nice.
Absolutely. That was the goal, to be able to reach every corner, every population, and show them that we care and we're here.
Thank you.
Do
Great,
you have
thank
any
you.
other questions?
Any other questions?
No, thank you for doing that though, like county girl myself. And I feel like if you have your pulse on the county, then if you have the outlier support, then it works its way from the outside in. So I feel like a lot of the outer county people feel like they're just out there, nobody cares. So I really appreciate that. So.
Yeah, and I will pass that kudos on to our community health worker who's stationed out there. She's doing a lot of great work. Thanks.
Thank you.
I had one quick question on finance. I just couldn't remember on the health, CHW's fund for COVID. I just can't remember what the public information and education, money it was going to. Could you just remind me? I know I've been told.
And you said this was for the CHW's COVID response fund. The public health or the public information and education line item is used for a wide variety of things for that grant. They purchase transpo bus passes for the community members. They purchase fuel gift cards. They purchase personalized swag to be able to hand out at their events. It's anything that would be able to be handed out to the public.
Okay, thanks. It's a big number, so it just caught my eye. Just couldn't remember. Any other questions? Comments? Hearing none, you want to go to the unit spotlight before we approve the report, or?
Why don't we go ahead and do the unit spotlight?
Okay, thank you.
Hello, everyone.
Hello.
Okay, so I'm Brianna. I'm the Assistant Director of Environmental Health, and today we're going to talk about radon. We figured we should use the unit spotlight and just shine that light on radon specifically because we haven't had a lot of opportunity to talk about what we're doing because we're kind of developing this in real time. So some of this might feel a little fuzzy, but it's because it's kind of our pilot program. So everything's not fine-tuned yet, but we're learning as we go. So I will start with a brief explanation of what radon is and why we care about it. So I'm sure most of you probably know already, but radon is a naturally occurring gas found in rock and soil. And typically it gets into our house by seeping in through cracks. So that could be foundation cracks, sump pumps, floor joints, whatever. It's the leading cause of lung cancer in non-smokers. So just to kind of give you an idea of what that looks like, if you have high radon, that's because you have 4 picocuries per liter or higher. That's the unit of measurement that the EPA uses to indicate that it's elevated. If your level is 4 or higher, it is the equivalent of smoking 8 cigarettes a day. So that's why it is the leading cause of lung cancer, because that's the amount of damage that it puts onto our lungs. So roughly 20,000 Americans die from lung cancer as a result of that exposure. So it's really important that we take action because our county has significantly high levels. It's predicted that 1 out of 4 homes in our county has a high radon level. And another example is that the EPA kind of breaks the entire country into 3 zones. And it's the first zone is like very dangerous, second zone is kind of dangerous, third zone is whatever. Our county is in that first zone. So it is alarming how high the levels are. I know we were just kind of talking about being county girls out there. That's where we see the most radon. So I don't mean to dim the light on the county girls in the room, but that's where the radon is the most prevalent. So it was important that we take a look at those rural parts of the county and address them. Some of those areas might be the way south side. So when I say south side, I don't mean like Riley High School. I mean, once you get out like towards Kern Road, New Carlisle, Walkerton, those parts, anything on the outskirts is where we're the most concerned. All right. So knowing that our county has these high levels, it was really Mark Espick's baby that we kind of do something and create a fine-tuned program here, because for a long time we have given out radon test kits, but we haven't had a legitimate program. So when we got the HFI money, this is kind of how we responded to that. So we built this up from scratch. You know, when we first started looking at this, one of our environmental health specialists, Jessica, who you'll hear me mention many times because she's very involved, she started doing research into see what other county health departments were doing, and she could only locate on the internet 1 health department in the entire country that had a radon program. She reached out to that health department. They had no idea what she was even talking about and realized that none of the staff that was there currently was there when they had the radon program. So it's like over 10 years old, their radon program. So we didn't really have a rubric to go off of. So we kind of just looked at the data and decided that we would create something for our county that would be helpful, that would stand the test of time. So even if our staff comes and goes, the structure itself would be strong, whether the staff was here or not. So Mark worked with Breeze Labs, and they have been a really incredible partner for us. They gave us 500 test kits to give out to the community, and they're very simple to use. So this is the test kit right here, tiny little box. You open it up. On the inside, this has all the instructions, and it's fairly simple. You just, and it'll explain it very easily, but you just take this little doohickey right here. You take the cap off, you set it in the lowest living space of your home. So typically that's the basement. You set it there for 2 to 4 days, and then you package everything up and you just send it out because it is already pre-labeled. So they don't have to pay for shipping. They don't have to pay for anything at all. They send it to the lab receives it. They notify us that they've received it, and then they send us the results. So it's very simple for the public to use, and they don't have to pay for anything at all. So
I assume the resident gets the results as well. Do you send it
of
to them?
course. So we get the results and the resident gets the results, and we contact them just to make sure that they receive that and then kind of walk them through. So any house that tests high or low, they will receive their results. But if it tests high, we will also kind of walk them through, what does that mean? What does that look like? Here are some small things you can do in the meantime. And also we will be paying for 25 homes to receive free remediation. So we don't just want to test people's homes and have them be scared. It's not, you know, our vision that the community just feels frightful. So everyone will receive education, but 25 will receive free remediation, and this is through the HFI funds. Okay. So this is data that we put together when we were submitting the health officer's report, but because I know you just heard about all those events we had, these numbers have basically doubled. When I put this together, we had 108 testing kits that had been given out to the public. It is now at about 200, which is amazing. We're very happy with that. 40 of those have been sent to the lab. I believe now it's about roughly 50 of those have been sent to the lab. And of those 40, we know that 8 houses have tested above the 4 picocuries per liter. So That is kind of a lowish number. We're doing our best to follow up with people who have not turned their kits in, but we don't want to harass them. So we'll send them an email, we'll call them, we're working on a letter to send out as well. But after about 3 communication attempts, we don't want to be, harassing the public about a radon kit. We just kind of accept the loss there and move on. But we are following up to ensure that as many of these kits that are handed out can be returned as possible. Okay. And then our plans for the future, I know Dr. mentioned this already. We have partnered with 6 libraries that are St. Joe County libraries. We've also partnered with, I believe it's North Liberty. They're not a part of St. Joe County Library System, but we partnered with them as well. So essentially 7 libraries, and they have been an incredible partner to us. They are actually tracking data for us. So when we hand out these kits, we don't just give them out willy-nilly. We take the information so that we can follow up with them. And the library has been very instrumental in taking that information as well. We actually, Jessica and I went out to a couple of libraries about 2 or 3 weeks ago, and 3 of those libraries already contacted us that they ran out of tests. So that's really good. We're happy that they're getting those going. Jessica also went out to speak with the South Bend Clinic in New Carlisle. So we're trying to contact local health systems as well, because we know that this can affect people's lungs. We want to be partnering with the medical group as well, so that we can kind of let them know that that is a service we have available. So next year, we will be testing more homes. We're trying to get as many homes as we can to be tested. So we're hoping to do more than 500 next year. We're hoping that we can offer more remediation based on those numbers. And then for those who we can't do free remediation systems for, that we can at least guide them with some low interest financing and things like that. Okay, does anyone have any questions?
Go ahead.
It's quite an alarming number of 1 out of 4 homes
Mhm.
are predicted to have a radon problem. What is the predictions determined on?
So that prediction is based on studies that the EPA has done based on average test results that they've collected over the years. So we're kind of finding in our own data that those numbers are maybe not, right now it's looking at about 1 in 5, but we think that's a little bit conflated because we're offering testing kits to the whole county. So if you look at the targeted areas, like in, New Carlisle, it might be 1 in 2 homes, but on a county level, it would be 1 in 4 or 1 in 5. But this is based off of EPA's data that they've collected over years.
Is there a region, you highlighted, New Carlisle, Walkerton?
Mhm.
I have to think that there are homes within South Bend and also the remaining parts of St. Joe County that have similar problems. So the question is, where is there a chance to communicate to the broader public that this is a large problem if 1 in 4 or 1 in
Mhm.
5 homes potentially have, and I'm gonna go right home and check myself.
Yeah.
Have this problem,
Yeah.
given that the rest of the statistics that 20,000 Americans die every year from this. So that's quite alarming. So what, is there an opportunity here, I guess, for us to communicate broader
Mhm.
electronically?
Yeah.
Whatever the school system, Dr. McGlory mentioned 100 schools.
Mhm.
What are we doing to communicate to those 200 or 50,000 kids that the problem might be at home,
Yeah.
as opposed to why you're having trouble learning and those types of things. So
Yeah, so I would like to note that the reason we're more concerned with the rural areas is because, again, because it seeps through cracks in foundation, you don't often find it in city landscapes. And if you look at national data, most cities don't really have a problem. It's definitely when you get out where there's more empty space, more greenery, and things are spread apart. That's where it's typically higher. But nonetheless, we offer it to everyone in the county. Some of the libraries we're at are on the outskirts, but we also have kits available at the downtown library. They also have posted flyers all over their library, so that everyone who goes into that library, which is pretty much anybody in the whole county, that library gets a lot of traffic, but that everyone there will know. We are kind of, again, because this is a pilot program, at first, we really wanted to target the areas that we know already based on EPA data. We wanted to target those first, but again, we do offer it to everyone. So we didn't initially plan to post things online or have a large social media presence about radon because we wanted to see, based on the resources we had available, if we could get it in those high zones first. Because at first we thought 500 kits would be too few. So we were really trying to focus on the pocket areas, but now that we have more testing kits available, we're kind of just,
So a
communicating to
broader, a
everyone.
broader communication plan can be developed
Yes,
in the
yes,
future based on
absolutely.
stuff. Okay,
yeah,
good.
absolutely.
We did reach out to John Glenn School System and
Mhm.
discuss an educational program. There's a poster contest
Mhm.
in March, I believe, every year for elementary school kids. And then there's another target sort of thing that science classes, kids in junior high age could do a radon test in their own house and, incorporate it into a science curriculum. So we have reached out. And I think we reached out at the beginning of the school year, but I think everybody's just trying to manage getting school scheduled and getting their routine down. But we are going to circle back to them and, repitch the idea because we do have the environmental department does have a curriculum that has been provided that we could
Sure.
share with the schools. But we want to be respectful of, the school has their required things they need, as you well know, things that they need to cover too.
Child safety and home safety are the most important things. So, and we all are aware of the difficulties that lead poisoning causes, learning and all of the other problems. But so just to hear that we're gonna spread our information out is good. So however means you choose to do that. So
Kristen?
thank you.
There's radon maps is there not?
Yes.
So, along the lines of sending out the information, it would be interesting if we could take the radon maps
Mhm.
and kind of send them home in their backpack
Mhm.
with a little information about testing and the kit testing.
Yeah.
Because how are they at the libraries, is it just the person noticing a flyer? Is that how they're?
So no, so actually, when they check out books at some of the stations where the librarian will be checking out books, they have it all front and center. So they told us that they're actually, when people come up to the counter saying, hey, did you know that if you live around here, which most of the time at these libraries, they know most of the people that come and go. So they're say like, they know they live in the town, they'll let them know they live in a hot spot and they'll ask them if they want to take one. So they have a more personable approach because they're kind of in these little communities.
Yeah.
So it's right there when they check out, they can't miss it. And they'll actually ask each person that they speak to take one home.
Got it.
Do you know, it sticks in my mind that, I don't know, 20 years ago, at least, I thought during a property sale, wasn't there, I wish Jill was here. But isn't there some kind of test that's done when a property sells to test for
Yes.
radon? Is that
Yeah.
not required?
I believe if it's a first-time homeowners, you do have to do it though, correct? Certain things you do have to, but.
Do we have access to those results or not? Is realtors willing to, do they give you that information when they get it or not? No?
That's been one of the biggest downsides. And us partnering with Breeze Lab will allow us to get the data, because in the past, we've always been able to obtain test kits from American Lung Association or even from the State Department of Health, but we hand them out and we never get the results back. And so this way, through Breeze, they'll submit everything to us on a spreadsheet, plus they'll also notify the homeowner.
I know you have a small sample where the results have been returned, but what areas of the county are you seeing that the tests themselves show elevated levels of radon? Do you have a?
So right now, surprising, we did not envision it, but really the south side of South Bend is showing really high levels and the ones that we predicted already. So New Carlisle, North
Yeah.
Liberty, Walkerton, those are all showing really high levels. It's kind of what we thought it would be. But then there's some pockets that aren't high at all that we thought would be, but that's typically where we're seeing it right now.
Because the rural areas, even on the east side of the county, the rural areas, they don't have as high, the concentrations of radon aren't as high, correct? Typically,
With the data we have, that's not what we're.
pardon? Or
Yeah.
am I wrong?
So the radon, it's coming from the breakdown of
Uh-huh.
bedrock. And so depending on the geology of the area, that would determine, the radon that's there.
Mhm.
So it's just a naturally occurring gas that's in the soil. And it really just depends on the bedrock.
Okay, so it can be more localized. We can't say Olive Township has a lot of radon, but Madison Township doesn't.
There are maps though that show,
Oh, okay.
you can look it up and
Yeah.
it'll show you, this area is like red and this one's orange. It's like, it's actually really interesting to look at for our
Okay.
county. And the south side has very clay soil on
Okay.
top of bedrock. So, and out east is sandy. So it makes me wonder if that's probably not part of it. But my son lives in River Park and he had to get a radon filter in his house and it was tested when he bought it. And I also wonder if, because there's an expense involved in that and it's not super cheap to actually fix your radon. So I think probably people worry about testing and labeling their house as a radon high house because then they have to fix it. You have to disclose that.
Mhm.
So they don't want to know that because they can sell their house and if they don't require the test, then they can move out and that's the next person's problem. But that's why it's like when you're trying to educate them, it's like, listen, you live there right now though. So you're going to move in 5 years, but you have 5 years of exposure. So, because that's what I've heard from people is, well, I don't want to know what I'm not staying here. It's like, yes, but you're there now. So that might be another thing to kind of throw in your bucket of education of like, listen, no exposure no amount of time is okay. So that's where the worry comes in though, is it's expensive.
Right. EPA has the level of 4 picocuries. The World Health Organization has it at 2.7. So we're looking into that and seeing, if we drop down to 2.7, we would double the number of failures that we have right now. But yeah, so and a mitigation system, they're not that expensive, $1,500 or so. I think we've budgeted around $2,000 per system. So we've kind of went over just in case, but that's what we're looking at. And what Breezy was saying earlier, we're looking for some low income financing for people that don't meet our qualifications to get a free system, that maybe we can find them a low interest loan that, but that's all, for 2025, we have much, this is just a pilot. We're just getting started. And then 2025, we plan on hitting it big with the schools, getting kids involved.
Well, I love that with what you're doing, because if we can show need, then maybe we need more money thrown in that direction, since it's a Midwest, our area problem that I'd hate to see anybody not get one that needs one. And I wonder if we can overlay somehow statistics with the radon belts where they're at and lung cancer diagnosis. I'm sure there's a way to do that. So that would just be more, not you're trying to put the fear of God in people, but kind of like, listen, look at this. So, but good job. Love that.
I do have another question. So far you've gotten the test kits for free from Breeze. Is that the name of the company?
Breeze Labs.
Breeze Labs.
We pay for them though.
Oh,
Yeah,
okay.
We use the Health First money to. pay.
Oh, okay. So I was just wondering, well, then how do we have more? So we have, this year's budget was for 500 tests. And then do we have something in the budget for next year for additional tests? Okay.
Okay, 2,500.
Oh,
Wait.
okay.
For the kit. Okay, 2,500 test kits.
Okay, 2,500 tests
Yeah.
for
For
next year?
next year,
Okay,
2,500 tests.
okay, okay. That's what I was wondering, when these tests came out, these tests all got distributed, how would we get more?
Yeah.
There we go. There's the answer. Thank you.
And then one more thing I want to know, I apologize, is that we recognize that the return rate is a little bit lower than we would like. This is kind of common in what we've seen for other units and other things that, or other programs that we do, that when you give things out, it's kind of hard to get it returned. We have found that anytime our staff, because it is an option when you ask for a kit, you can click if you would like for us to come set it up for you. Otherwise, they are able to set it up themselves because it's very simple, but some people do prefer that we come set it up. And obviously on those ones, we have a 100% return rate because we came to their house. So I think they feel a little bit more inclined to handle it. So we are working on kind of writing up a policy and procedure and kind of fine tuning what that will look like, because we don't have the capacity currently to set up hundreds of kits. But if we can fine tune that to where we set up as many as we can to increase our return rate, that would be beneficial. So we're looking at those types of things, but again, it is a pilot program currently.
Okay, thank you very much.
Thank you.
That's it. Thank you. So, we need to make a motion to approve, or we need a motion to approve the health officer's report as presented.
I motion to approve the health officer's presentation and report.
I will second it.
Motion and a second. Any further discussion or comment? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. All right, moving along. Next item on the agenda under new business, item 2437, discussion and vote Department of Health fee schedule, nursing unit.
Don, I believe we were going to table this till next month.
My error. That's right. You sent me an email. I apologize that we are going to table this until next month. Can we get a motion to table?
I make a motion to table 2437.
I will second.
Motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, a grant request, item 2438, discussion and vote, apply and receive health, community health workers for COVID CDC.
Hello,
Hello.
I spoke about this during our unit spotlight last month, and I apologize. I didn't realize I had to go through this process for the extension. So here I am. So the CDC allowed for us to apply to use any funds that was not used during the performance period. And we had over $700,000 left over. The only caveat was that you couldn't do any new work plan activities. So we basically had to say what we were going to continue that would be the same to continue operations with our community health workers. And we also had to say what the justification was. So we had significant turnover, as you are aware, in our unit. So we used that to say, hey, if we have more time, we can continue to use this money and continue operations. So that's what we did.
Okay. Any questions or comments? If not, I will entertain a motion.
Oh, I will move to approve the application and reception of the health CHWs for COVID, no cost extension.
Second.
We have a motion and a second. Any further discussion? Questions? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Thank you. We have no old business. So moving on to public comment. If any member of the public out there would like to speak, please put your name on the sign-up sheet that's over by the exit entry door. We have nobody? So do I have to read this statement then, Marcel? No, great. Next item on the agenda, time and place of the next regular meeting. It'll be October 16th, 2024, 4:30, right here again in the 4th floor council chambers. So last item is adjournment.
Make a motion to adjourn.
Thank you.
Second.
All right, we are adjourned. Thank you, everybody.
But did we speak loud enough for Jenny? Did we speak loud enough?